reach also, this platform. Let's hope that people will be using Facebook and Insta and other options also.
Exactly. Exactly. I think
Self.
we are live now. I'll just check with my team if they are live and then we can start. Guru, can you check and tell if you are live?
Yes.
Can we start? We can start?
You are live.
Okay. All right. I think we are all set. Thank you very much for this. So good evening, good afternoon, all of you. Welcome to Beyond Pinks. And it's my pleasure to be a part of this gathering this afternoon, this evening that we are together here. The purpose of we joining us together is to create awareness towards breast cancer. The month of October basically is dedicated towards Breast Cancer Awareness Month, and we at Beyond Pinks work tirelessly towards health and well-being of women. That's one of our agendas, and I am the founder of Beyond Pinks. It's my pleasure to host this event and this webinar, and we have two wonderful people who are there on our panel here. I would take the privilege to introduce you to Meenakshi Anantram. No prizes for guessing who is the person who is Meenakshi here on the screen. Uh, Meenakshi is a very, very good old friend. We go back 20 years plus. And Meenakshi and her husband Anantram run a foundation. They are basically based out of Vizag, and their foundation is called Rohit Memorial Trust. Rohit Memorial Trust basically works extensively towards providing help and support and counseling for people dealing with terminal diseases, especially on cancer. And they work extensively on creating awareness, and they're also doing a lot of work towards help, psychological, emotional, medical help for people suffering with cancer. They also run a very interesting program for women and child welfare on the wellness. It's called the Gyana Lakshmi. And they do programs around education and health for children. So they do something called the Gyan Pathshala also. More about that as we go. And Meenakshi, thank you very much for joining us on this cause and making this effort to be here today with us. Thank you very much for this. And Meenakshi has a lot of passion towards this cause, and she's been working tirelessly on this cause along with Anantram. So, Meenakshi, I would like to hand it over to you to take the session forward, please.
Thank you, Tanuja. And we congratulate Beyond Pinks for starting a wonderful journey for all our sisters and brothers in the world. Namaste, Namaskar, Sat Sri Akal, and Vanakkam. It is the wonderful month of October, and we've all gathered here to talk and discuss about an enemy that is so commonly prevalent, breast cancer. Breast cancer is the most common cancer in women in India. 27.7% of new cancers detected in women show that breast cancer is 27% of the cancers that are detected every year. One woman is diagnosed with breast cancer in India every 4 minutes. One woman dies of breast cancer in India every 8 minutes. An estimated 164,000 men and women are detected with breast cancer in India, and India is the second highest in the world for breast cancer incidence. There is no age bar, and India is soon reaching the top level in being one of the top predominant countries for breast cancer. In such a scenario, a stitch in time saves 9 is what we think. And to start an entire series, मी अंदरुतो मातड़ालंटे आप सबको एक साथ इकट्ठा एक प्लेटफॉर्म ले लाने के लिए प्रयत्न है. This is an effort to reach out to our brothers and sisters. When I say brothers, men also have breasts. Men also have cancers in the breast. So listen, boys and girls, we have with us a very well-known doctor, a gentleman who's traveled the world, who's traveled the journey of oncology to different levels. And without much ado, I would like to introduce our speaker, whom I will be introducing and moderating for. I'm indeed privileged to have with us in the studio Dr. Palani Satya Dattatreya. He's a DM in medical oncology, a DNB, Diplomate of National Board Medical Oncology. He's a super specialist from the Gujarat Cancer Research Institute, Ahmedabad. He's also a super specialist with theory papers at the BJ Medical College, Ahmedabad. And he's working right now from the 1st of July 2010 at the Omega Hospitals at Hyderabad. But what is interesting is he started his life under Dr. Pankaj Shah as a research teacher and guide, who was his guide at the Gujarat Cancer Institute, a world famous cancer institute. He has also been a full time consultant at the Medical Oncology Board of the Indo American Cancer Institute and Research Center, Banjara Hills, Hyderabad. With such a profile, and after doing my homework in Jusanante, this young doctor that we have is a full knowledge bank of energy. And also, he brings to us very simple tips and simple knowledge about a very dreadful disease. So, it's a great honor, Doctor, to have you in our midst. And I hand over the first session of introduction and curtain raiser to you. So, girls and boys, sit back, have your cup of tea, but remember, we are discussing a very serious enemy, cancer in the breast. It's over now to Dr. Palni Satya Dattatreya.
Thank you so much, ma'am. Thank you so much, everybody. A very good evening to all of you. First of all, let me start by letting you know that October is the month which is labeled as Breast Cancer Awareness Month. But having said that, the risk for breast cancer runs perennially. It knows no age, it does not know any male or female gender or caste or religion. It goes beyond boundaries, and therefore, I think every single day, every single week, every month, and entire year should be dedicated to women's health, to health overall, and cancer in particular, because we all have learned the meaning of the word pandemic with the advent of the coronavirus and the COVID-19 disease. But then the breast cancer pandemic has been there for quite many decades. So I think it's my privilege and my prestige to be a part of this platform so that I can spread awareness about breast cancer, especially in this month of October, which is labeled as the Breast Cancer Awareness Month. But this campaign will be continued throughout this month and then way beyond that as well, because we want to reach out to the urban areas, to the semi-urban areas, to towns and to villages, and make sure the health of all women across the entire country should be reached out in the right manner, so that prevention, as we all know, is always better than cure. And therefore, early diagnosis will be able to make us have more cure rates and more control rates. As ma'am rightly mentioned, a stitch in time saves nine. Breast cancer, if diagnosed early, is curable, and that applies to almost every cancer. We are here to talk today, particularly on breast cancer, because this is the Breast Cancer Awareness Month. Interestingly, this month also is called as the Liver Cancer Awareness Month as well. So, therefore, it's not just breast cancer; it's also liver cancer, which has to be highlighted. Having said that, our focus this month is to look at women's health, and for that, we want to plan a series of activities so that awareness against this dreaded disease can be brought out in the open, and then we can fight the disease much more judiciously. See, if we can fight a problem if we know our enemy. And that's what we plan to do today. I and Dr. Meenakshi plan to take you on a small journey about how we can raise awareness across everyone present today with us about self care and diagnosis of breast cancer. So I would like to end by saying what Madam mentioned: a stitch in time saves nine, and more importantly, cancer is curable if diagnosed early and optimally treated. Thank you so much, everyone, for being with
Thank you.
us.
Thank you, Doctor. Doctor, now మా ఆడియన్స్లో చాలా మంది ఉన్నారు. Everybody is frightened. The word cancer does not belong to us. I still remember when our son was diagnosed and the word cancer came up in his report, we felt it was somebody else's disease. So, what is cancer? Broadly, what is cancer and what is cancer in the breast? ऐसे मैंने जो भी हमारे भाई भाई बहन जो सुन रहे हैं उनको कैंसर शब्द का अर्थ बताइए और उस शब्द के साथ द यू नो द आइडियाज दैट कम is that the what is the true meaning of the word cancer? Should we be frightened of it? And how do we understand breast cancer?
जी, थैंक यू सो मच मैम, दैट आई थिंक इज द मोस्ट इम्पोर्टेंट क्वेश्चन। अब सबसे पहली बात तो ये कैंसर शब्द से अपने को डर लगता था एक 20-30 ईयर्स बैक, 50 ईयर्स बैक। पर आजकल के जो डेवलपमेंट्स हुए हैं इन द लास्ट 10 ईयर्स, पिछले 10 साल में जो डेवलपमेंट्स हुए हैं, एस्पेशली इन द लास्ट 1 to 2 decades, लाइक ऑपरेशन तो कैंसर ने ट्रीटमेंट చేయొచ్చు, సో దట్ ఫీల్డ్ ఈజ్ సర్జికల్ ఆంకాలజీ. ఎక్స్రేస్ రేడియేషన్లో క్యాన్సర్ని మొత్తం కంట్రోల్ చేసేయచ్చు, దట్ ఈస్ రేడియేషన్ ఆంకాలజీ. మందులతో ఈ జబ్బును తగ్గించవచ్చు బై గివింగ్ కెమికల్స్, బై గివింగ్ టార్గెటెడ్ థెరపీస్, బై గివింగ్ ఇమ్యూనోథెరపీ. దట్స్ ఎ ఫీల్డ్ కాల్డ్ ఎస్ మెడికల్ ఆంకాలజీ. అలాగే డయాగ్నోసిస్ అంటే జబ్బుని ఎలా ముందే కనుక్కోవాలి, బయాప్సీ చేసి దానికోసం పెట్ సిటీ స్కాన్, ఎంఆర్ఐ, మ్యామోగ్రఫీ, ఈ అన్ని డెవలప్మెంట్స్ లాస్ట్ 10-20 ఇయర్స్లో చాలా ఎక్కువయ్యాయి. అందుకే ఇప్పుడు క్యాన్సర్ కామన్ వర్డ్ అయిపోయినా కూడా దాంతో అంత భయపడాల్సిన అవసరం లేదు. All of us now know cancer is not uncommon. Somebody who is known to us in our family, in our relatives, in our friends, or in far distant relatives would be having a lurking cancer. But we all now know with the amount of team effort we have, we are able to tackle the disease much more effectively. So to answer the meaning of the word cancer, the term cancer refers to a mass of cells or a group of cells which are growing uncontrollably. And this growth is responsible for a mass forming. And something has triggered the growth to happen. Like lung cancer, we know the cause commonly is tobacco chewing or the tobacco carcinogens. Head and neck cancer, the cause is commonly tobacco chewing. So tobacco chewing and tobacco smoking commonly cause head and neck cancer or lung cancer. Now for breast cancer, that cause which has caused the cells to grow uncontrollably is right now not known. But we know there are some risk factors. A combination of those risk factors may cause some of the breast duct cells to grow uncontrollably. So it's a mass of cells with the growth of which exceeds that of surrounding normal cells. And this growth is uncontrolled and it persists in the same excessive manner despite cessation of stimuli which evoked that change. So there was some reason, ఏదో కారణం వల్ల ఆ సెల్స్ మల్టిప్లై అవుతున్నాయి. ఆ కారణం తీసేసినా కూడా ఈ సెల్స్ ఇంకా మల్టిప్లై అవుతూనే ఉన్నాయి. నెమ్మదిగా పెరిగి పెరిగి ఒక గడ్డలా మారుతుంది. తర్వాత ఆ గడ్డ నెమ్మదిగా ఇట్ మే గో టు నైబరింగ్ ఆర్గన్స్ లైక్ ద లింఫ్ నోడ్స్. లివర్కి పాకచ్చు, బోన్స్కి వెళ్ళొచ్చు, లంగ్స్కి వెళ్ళొచ్చు. అది పాకకుండా ముందే, అసలు ఫస్ట్ ఆఫ్ ఆల్ క్యాన్సర్ కాకుండా ముందే కనుక్కోవాలి మనం. దాన్ని స్క్రీనింగ్ అంటాం. అంటే డయాగ్నోజింగ్ క్యాన్సర్ బిఫోర్ ఐ నో ఐ హ్యావ్ క్యాన్సర్ or anybody knows they have cancer. Cancer ఉన్నా కూడా అది ఎర్లీగా కనుక్కుంటే క్యూర్ అయ్యే అవకాశం is more than 90%. So to cut the long story short, cancer is an abnormal mass of cells which grows uncontrollably and nothing is able to stop that growth. It behaves abnormally and you may add that this mass is purposeless. There is no reason for it. It is autonomous, nothing controls it. And it's a parasite. So it starts devouring our body's nutrients and therefore ultimately affects our immune system.
Sir, do we
So
get
cancer and
sure.
Yes, madam.
Do we get symptoms?
So,
I mean, are there any early symptoms for cancer? Does a normal human being, is a person able to intercept the fact that they are prone or there is something wrong with them? What are the first symptoms that we can experience to get alerted? Does a cancer give a symptom?
ma'am. So again, like me again, madam, first question was what is cancer and what is breast cancer in particular. So that has been answered. Now, what are the early warning signals of cancer? And then what can be the early warning signals or signs of breast cancer? So any change in bladder or bowel habits, మోషన్స్ ఎక్కువ అయిపోతున్నాయి, 3 months అయిపోయింది, 6 months అయిపోయింది, ఇంప్రూవ్మెంట్ లేదు. యూరిన్లో బ్లడ్ పడుతుంది మధ్య మధ్యలో, 4-5 months అయిపోయింది, అయినా మనకి తగ్గలేదు. Any change in bladder bowel habits might be a sign of bowel cancer or a urinary tract cancer. Any change in voice, like soreness of the throat, లేకపోతే వాయిస్ సరిగ్గా రాకపోవడం, unusual bleeding or discharge from any of the orifices, any thickening, any lumps, any bumps, lymph nodes లో lumps రావడం, లేకపోతే బ్రెస్ట్ లో గడ్డలు కనపడడం, సో లైక్ unexplained bleeding or discharge, ఇండైజెషన్, కడుపులో ఇబ్బందిగా ఉండడం, పెప్టిక్ అల్సర్ సిమ్టమ్స్, ట్రీట్మెంట్ తీసుకుని తగ్గట్లేదు, కడుపులో ఎసిడిటీ ఉంటూనే ఉంటుంది. ఎనీ నాగింగ్ కాఫ్, లైక్ దగ్గు ఉంది, ట్రీట్మెంట్ తీసుకుంటున్నాం తగ్గట్లేదు, అది ఆల్మోస్ట్ 3 months అయిపోయింది, 6 months అయిపోయింది, మనకి ఏదో ఒక ప్రాబ్లం ఉంది, ఆ ప్రాబ్లం ట్రీట్మెంట్ తీసుకుని తగ్గట్లేదు. ఇవన్నీ ఎర్లీ వార్నింగ్ సిగ్నల్స్ ఆఫ్ క్యాన్సర్. ఈ సేమ్ సైన్స్ అండ్ సిమ్టమ్స్ మామూలుగా మిగతా ప్రాబ్లమ్స్ లో కూడా ఉండొచ్చు. ఇవి ఉన్నాయి అంటే క్యాన్సర్ అని కాదు, కానీ దీస్ ఆర్ ఎర్లీ వార్నింగ్ సిగ్నల్స్ దట్ యూ షుడ్ కన్సల్ట్ యువర్ డాక్టర్, బికాస్ 3 months have passed, 2 months have passed, 6 months have passed, and even now improvement has not been seen. So these are some early warning signals of cancer in general. దీన్ని మామూలుగా మనం చెప్పడానికి గుర్తు, ఫర్ ద లే పబ్లిక్ we call it as caution. C stands for changes in bladder and bowel habits. A stands for any ulcer which does not heal, any sore which does not heal. U stands for unexplained bleeding or discharge. T stands for thickening or lumps or bumps. I stands for indigestion, some GI complaints like peptic ulcer, dyspepsia, acidity, hyperacidity. O stands for obvious change in the most. పుట్టుమచ్చల్లో మార్పు కనపడుతూ ఉంటే అది మనకి ఆ పుట్టుమచ్చలో క్యాన్సర్ గా వస్తుంది. And lastly, N stands for nagging cough. Now coming to breast cancer in particular, because that's the theme of today's discussion. Any hardness in the breast on either side, any thickening of the skin, or you find that there is something which has become hard or firm and is not reducing and is growing. Some discharge happening from the nipples. నార్మల్గా బ్రెస్ట్ క్యాన్సర్ కనుక అక్కడ గడ్డ నెమ్మదిగా పెరుగుతుంది, లోపల కనుక ఉంటే అది నెమ్మదిగా గ్రాడ్యువల్లీ లింఫ్ నోడ్స్ కి పాకుతూ ఉంటుంది మన చక్కల్లో, ఇన్ ది యాక్సిల్లా. సో యూ మే ఫైండ్ లింఫ్ నోడ్స్ ఇన్ ది యాక్సిల్లా, సమ్ నెక్ నోడ్స్. సో ఇవి కామన్ ఎర్లీ వార్నింగ్ సిగ్నల్స్ ఆఫ్ బ్రెస్ట్ క్యాన్సర్. అందుకే బ్రెస్ట్ సెల్ఫ్ ఎగ్జామినేషన్ అని చెప్పి ఎవ్రీ మంత్లీ వన్స్ females of all ages, especially after 25, 30, 40, 50 years, should get themselves examined, especially in the taking a bath, so that they can identify these early warning signals. Any lumps, any bumps, any thickening, any discharge on the nipple, it could be bloody. So these are all, in my opinion, the early warning signals. So I sign off by telling that don't miss these early warning signals. Your body, because of some change, is trying to tell you there's something going wrong. Don't miss to notice that change.
Thank you, Doctor. Doctor, very often we think that women who are postmenopausal, they are the people who are victims for cancers. But nowadays we see younger girls, younger boys also coming up with breast cancer. So is it true that younger girls should not sit, feeling that it is not a disease or something that they are going to get? It only belongs to an older menopausal woman group. What do you have to say about the statistics and, occurrence of younger women and younger men contracting breast cancers?
I think చాలా ఇంపార్టెంట్ క్వశ్చన్ మేడం అడిగారు. ఎందుకంటే కామన్ గా మనం అందరం అనుకుంటాం కి బ్రెస్ట్ క్యాన్సర్ ఈజ్ ఎ ఏజ్ ఆఫ్ ఓల్డర్ ఫీమేల్స్. సో అందుకోసమని, and in a way partly it's right also. 70 to 80% of breast cancers in the West, for example America or UK, commonly happens after the age of 50 years. But then in India especially, we have been seeing that more and more younger females also are getting it. Now I would not say it's like say 50%, but then still compared to the West, the incidence of breast cancer happening in younger age is slightly bit more in the Indian subcontinent. But again, as I told you in the beginning also, breast cancer does not see age. Commonly, it happens in older females, but that does not mean it's uncommon in younger females. అందుకోసం if you look at the guidelines or recommendations, 40 years కంటే ఎక్కువ ఉంటే మనం రెగ్యులర్గా బ్రెస్ట్ ఎగ్జామినేషన్ చేసుకుంటూ ఉండాలి. And then above the age of 50 years, mammogram also comes in the picture. Now that's called as screening. And now there are patients where the breast cancer gets missed because that she delivered a baby recently, and then she did find some lumps, etc. But then because she thought it is commonly happening as a physiology in lactation, they miss it out. In fact, a similar patient I just saw a few weeks back, and then by that time it gets delayed. So the body is trying to send you some signals, and we should not neglect those signals or those signs. So age does not mean you will not get any particular cancer. So it can be 30 years, can be 40 years, any lump, any bump, any suspicion, your body is sending a signal. Don't neglect. Especially if it's become more than 4 to 8 weeks, it's important that a doctor sees you. So I think I would like to conclude that age is not a bar, and as madam told earlier, even a gender is not a bar, because male breast cancers also do happen. So any obvious signs or signals your body is sending, make sure you attend to it, and if it's persisting, meet your doctor.
So what are the risk factors? ఇప్పుడు who are the people మన ఇలాగుంటే మనకి క్యాన్సర్ ఛాన్స్ ఉండొచ్చు, ऐसी सेहत के लोगों को कैंसर ज्यादा आता है. नहीं तो फैमिलीज में इट रन्स इन फैमिलीज, जैसे माँ को हुआ था, नहीं तो ग्रैंडमदर को हुआ था, तो मुझे होने का संभावना है. So what are the risk factors? Can we be broad in discussing, because people who are listening, we might have relatives and we might have the worry whether we are prone to be a risk patient. So what are the risk factors for breast cancer?
Evaluate discussion in this last 60 minutes, I think this is possibly the most important question. Now, for example, lung cancer ki manaki karanam tells usually cigarette smoking అని చెప్పి, head and neck cancer karanam tells manaki usually tobacco chewing, gutka, pan masala, etc. Breast cancer ki exact ga idi ani karanam teliyadu, but it's a combination of various risk factors which is able to cause breast cancer. Now, the main risk factor is number one being female, and number two getting older with age. Having said that, again, male breast cancer also happens and younger females also get breast cancer, but these are two important risk factors. Now, in addition to that, you may have a woman who doesn't have any risk factors and still can get breast cancer. You may have some females who have some risk factors and still may not get breast cancer, and you may have females who have many risk factors and they ultimately end up getting the breast cancer. So మనం తెలుసుకోవాల్సింది ఏంటంటే, ఈ రిస్క్ ఫ్యాక్టర్స్ ఉండడం వల్ల it gives you an idea that how you can tackle the disease early on, and that's what is very important. Diagnosing cancer early or not missing the signs is important. నేను యూజువలీ నా పేషెంట్స్తో ఫ్యామిలీస్తో మాట్లాడుతున్నప్పుడు ఈ రిస్క్ ఫ్యాక్టర్స్ని రెండుగా డివైడ్ చేస్తాను. నెంబర్ వన్, రిస్క్ ఫ్యాక్టర్స్ ఏది నేను మార్చగలను, రిస్క్ ఫ్యాక్టర్స్ విచ్ ఐ కెన్ చేంజ్, అండ్ నెంబర్ టూ, రిస్క్ ఫ్యాక్టర్స్ విచ్ ఐ కెనాట్ చేంజ్. సో రిస్క్ ఫ్యాక్టర్స్ విచ్ ఐ కెనాట్ చేంజ్ ఇస్, ఫర్ ఎగ్జాంపుల్, బీయింగ్ ఫీమేల్ is something which I cannot change, and being female is an important risk factor for getting breast cancer. But males also can get it. Number two, aging is natural. So getting older is something which I cannot change. So if you look at proportion of patients with breast cancer, a good number of them usually are females, and a good number of them are older and more than 50 years. Now, personal history of breast cancer, I think madam adi important ga stress chestunaru. Ini oka female ki breast cancer వచ్చింది, రైట్ బ్రెస్ట్ లో క్యాన్సర్, అది క్యూర్ అయిపోయింది, 5 years అయిపోయింది, కానీ లెఫ్ట్ బ్రెస్ట్ లో మళ్ళీ క్యాన్సర్ రావచ్చు. సో పర్సనల్ హిస్టరీ ఆఫ్ బ్రెస్ట్ క్యాన్సర్ or ovary cancer means there is a chance you might get again in the opposite side breast cancer. Female is around 40 years, 35 years, has breast cancer, operation అయిపోయింది కానీ usually young females prefer breast conserving surgery. అంటే
Wow.
మనకు ఆపరేషన్ చోటు తీసేసాం, అక్కడ ఇంకా చెప్పలేదు, మొత్తం తగ్గిపోయింది, కానీ
Mm.
రిమైనింగ్ బ్రెస్ట్ లో మళ్ళీ క్యాన్సర్ రావచ్చు. అందుకే రాకుండా రేడియేషన్ ఇస్తాం అనమాట, సో దట్ వీ కెన్ టాకిల్ ద ప్రాబ్లమ్ క్లియర్లీ వన్స్ అండ్ ఫర్ ఆల్. ఫ్యామిలీ హిస్టరీ ఆఫ్ బ్రెస్ట్ క్యాన్సర్. ఒక సిస్టర్ కి బ్రెస్ట్ క్యాన్సర్ ఉంది, మదర్ హ్యాడ్ బ్రెస్ట్ క్యాన్సర్, మెటర్నల్ గ్రాండ్ మదర్ had బ్రెస్ట్ క్యాన్సర్, సంబడి ఎల్స్ had ovary cancer, somebody had endometrium uterine cancer. So family history of breast cancer, chances become high. History of reproductive history అంటే లైక్ ఫర్ ఎగ్జాంపుల్ లైక్ ఎర్లీ మెనార్కీ, కొంచెం మెన్సెస్ ముందుగానే at 11 years, 9 years, 10 years, late menopause, menopause happening after 50 years, nulliparity, not having children. So the longer you're exposed to regular menstrual cycles, say before the age of 10 to after 50, the more the chance your hormone imbalances might cause the breast cancer. అందుకే when pregnancy happens, especially before the age of 30, that cycles get disturbed for almost 1 to 1.5 years. So having pregnancy actually protects against breast cancer, especially before the age of 30. సో నల్లి ప్యారిటీ అంటే అసలు పిల్లలు పుట్టకపోవడం, అప్పుడు నల్లి ప్యారిటీ బికమ్స్ ఏ రిస్క్. అగైన్ ఇవన్నీ రిస్క్ ఫ్యాక్టర్స్ అండి. సో యూ మే హ్యావ్ ఆల్ ద రిస్క్ ఫ్యాక్టర్స్, దట్ మీన్స్ యూ షుడ్ బి కాషియస్. ఇట్ డజంట్ మీన్ యూర్ గోయింగ్ టు గెట్ బ్రెస్ట్ క్యాన్సర్. సో మై జాబ్ టుడే ఈస్ టు మేక్ యూ అవేర్ ఆఫ్ సమ్ రిస్క్ ఫ్యాక్టర్స్ అండ్ రియలైజ్ దట్ ఎ కాంబినేషన్ ఆఫ్ దీస్ రిస్క్ ఫ్యాక్టర్స్ రెస్పాన్సిబుల్ ఫర్ గెటింగ్ క్యాన్సర్ or breast cancer. Now, we all know about the famous Hollywood actress Angelina Jolie. Her mother had a problem in the genes called as the BRCA genes, and when she got herself tested, so ఆవిడలో కూడా ఆ జీన్స్ బయటపడ్డాయి. సో
Okay.
అందుకోసమని she got herself tested and then proactively got some risk reducing surgery done. So with that, she now has a very, very, very minimal chance of getting breast cancer, ovarian cancer. So family history is very important. Personal history is important. Genetic mutations are important. Now, these risk factors you cannot change. Coming to the most important part, what can I change? So not being physically active. మనం సెడెంటరీ లైఫ్ స్టైల్ ఉంటే కనుక అప్పుడు ఈ బ్రెస్ట్ క్యాన్సర్ వచ్చే అవకాశం ఎక్కువ ఉంటుంది. బీయింగ్ ఓవర్ వెయిట్, especially as you grow older, again is a risk. Obesity is a risk for getting breast cancer. Taking some hormones like hormone replacement therapy, especially some oral contraceptive pills etc., contain more estrogens, some progesterone, and they also can cause or predispose to get breast cancer. Having age first pregnancy beyond the age of 30, not breastfeeding, never having a full-term pregnancy also are risk factors which are modifiable. And last but not the least is avoiding alcohol. Drinking alcohol is a risk factor for getting breast cancer. So some risk factors you can change and some risk factors you cannot change. I would personally prefer that what you can change is try to be physically active, avoid being overweight, don't get obese, try to avoid taking hormones. If you're taking them, tell your doctor that I would like to have these pills which don't have these hormone replacement therapies. Make sure that your history of reproduction is on the right side and avoid alcohol. Thank you so much, ma'am. I think
Yes,
your question
doctor.
was very important because
Yes.
I wanted to make sure everybody knows about what I can change and what I cannot change.
Doctor, there is, I mean, I'm just asking something that I personally have heard. Women with bigger breasts have a larger chance of risk of breast cancer, is what we used to think as we grew up. Is that correct?
In a way, that's true, madam. I mean, like because when you have dense breasts, you are likely to have more connective tissue than fatty tissue. So there is data to say that sometimes it might be hard to see those tumors on a mammogram when you have dense breasts. And these patients are probably more likely to get breast cancer, but that's only one of the many risk factors. I'll again like to stress that breast cancer happens because of a combination of various risk factors, and you can't identify one single factor as the reason for that woman getting breast cancer. There are a good number of patients where the mother had the BRCA genes positive. The patient also had the BRCA gene but still didn't get the breast cancer. So the chances of getting breast cancer may increase, but then other factors also have to come. So let me also conclude by telling you that by and large, cancer is a lifestyle disease
Correct.
and more so for breast cancer. So you have factors which you can modify, and if you can modify that, then you'll be able to negate some of the risk factors which you may have. And one such risk factor, as you rightly mentioned, is having dense breast because you have more connective tissue than fatty tissue there. So what also happens is when you have more dense tissue, early tumors on a mammogram might be missed.
Uh, Doctor, you're talking about mammograms. There is a group of women, there is a group of thought that mammograms are dangerous. So, on one side, we are asked to go for mammograms to check out any lumps or any growth in our breast. On the other side, there is a group that says that it is actually harmful. What would you advise? Because we used to go around telling everybody, don't buy that sari for your birthday. Spend that money in buying, yourself a mammogram. But in return, we used to get this thing about, can you guarantee? Because many people have a reaction, and mammograms are caused. The radiation causes breast cancer. So there is this feeling. A
So,
mammogram.
ma'am, no, ma'am, I think a very, very, very important question pertinent to today. I mean, this myth which has come is true because of the data which has come some 10, 15, 20 years back. Now there are only few cancers where you can screen. You can identify breast cancer early by doing a mammogram, a breast self-examination, clinical breast examination. You can identify prostate cancer by doing a simple blood test in males called a serum PSA test. You can identify a large bowel cancer, పెద్ద పేగు క్యాన్సర్ ముందే కనుక్కోవచ్చు. రెగ్యులర్గా ఒక వయసు వచ్చాక ఆఫ్టర్ 50 years కొలనోస్కోపీ చేసి ముందే కనుక్కోవచ్చు. అలాగే ఫీకల్ ఒక బ్లడ్ స్టూన్లో బ్లడ్ కనుక్కుంటే అప్పుడు కొంచెం అలర్ట్ అవుతాం కనుక అలాగా మనం ముందే కనుక్కోవచ్చు. లాస్ట్లీ ఫీమేల్స్లో గర్భాశయ ముఖం క్యాన్సర్, సర్వైకల్ క్యాన్సర్కి బై డూయింగ్ ఎ సింపుల్ టెస్ట్ కాల్డ్ as pap smear యూ
Yes.
కెన్ ఐడెంటిఫై సర్వైకల్ క్యాన్సర్ ఎర్లీ. ఈ 4 క్యాన్సర్లు తప్ప ఇంకా ఏ క్యాన్సర్కి స్క్రీనింగ్ లేదండి. యూ కాంట్ ఐడెంటిఫై లంగ్ క్యాన్సర్ ఎర్లీ, బ్లడ్ క్యాన్సర్ ఎర్లీ or stomach cancer early, right? But you can identify only these 4 cancers early on. Now, initial mammograms which we had a decade or 1.5 decade back, and the mammograms which we have now today, the radiation exposure is much less.
Okay.
Number two, we are going to get the mammograms after the 50 years of age. And then after the initial few mammograms annually, you then do it once in 2 years. The stress now is more on breast self-examination. మీరే మీ బాడీలో ఉన్న సైన్స్ని ముందే కనుక్కోవాలి. అలర్ట్ అయ్యి అప్పుడు డాక్టర్ని కలవాలి. అది నెంబర్ 1. నెంబర్ 2, అది అయిపోయాక డాక్టర్ గారు చూసి దే విల్ డూ ఎ సిబిఈ ఆర్ ఎ క్లినికల్ బ్రెస్ట్ ఎగ్జామినేషన్. దాంట్లో మనకి చాలా మటుకు ఐడియా వచ్చేస్తుంది. యువర్ బాడీ హెస్ సెండ్ యూ సమ్ సిగ్నల్స్, యూ గాట్ అలర్టెడ్, అండ్ దెన్ ఇఫ్ రిక్వైర్డ్ దెన్ ద mammogram is done. So it's now not as if everybody has to blindly get it done. We are trying to minimize. So therefore, beyond the age of 40, recommend cheyatledu. Beyond the age of 40, don't miss out those signals or sign. Beyond the age of 50 up to 74 years, we are recommending mammograms as screening with much more lower exposures of radiation and which much more newer sophisticated diagnostic techniques. So in both ways, it's a win-win situation. So let me conclude by telling number 1 is breast self-examination, number 2 is clinical breast examination, and then number 3 comes mammogram in the picture. Inkoka point, madam. Less than the age of 40 years, we prefer doing an ultrasound and not an X-ray mammogram. More than the age of 50 years, we do a proper X-ray mammogram. Between 40 to 50, it's a combination of these.
Sir, there is a joke. There is a saying, just funnily, wish women would look at their breasts, not only men look at the women's breasts, wish women look more at their breasts rather than the men. But the truth is, men are also having breast cancers. How does the diagnosis of breast cancer in a man differ from a woman? We have a lot of men watching this program now. If a man, now their breasts are small, isn't it? They're not like women breasts. So what are the diagnostic tools that you use, or how does a man know that he has to go and check out for a breast cancer? How does it differ from man to woman?
Um, Fortunately for men and unfortunately for females, the amount of fat tissue in a male breast is very, very, very less. So any change which happens there is very easily seen by the male, and therefore the slightest of thickening or a lump or a bump will alert the male immediately, which
Yeah.
doesn't happen in the case of females. So that's very unfortunate. It's a woman's health which should be a priority, but it's there that things get delayed. As far
Yes.
as the male breast cancer identification is concerned, it almost always happens much more early than a female breast cancer. And I think it's very, very important, though it was meant to be on the lighter side, but the point that you brought out was that it's important that the husband also gives equal priority so that he can be the first person to identify the lump or a change, and then both of them should go to meet the doctor. It does happen many times in a practice that when the history is taken, then the lady tells me that, or the husband tells me that I found something abnormal, I got alerted, and I have brought her to you. And that brings lot of joy to me, because
Yes.
it's equally important that the husband also plays an important role in making sure he doesn't miss any signs or signals. See, females these days, especially when their wives and then mothers are concerned more about their family as a whole, about their kids' future, their career. In fact, they sacrifice their studies, etc., for their children to grow, and it happens they neglect their own health.
Very
It's
true.
then the husband prerogative that he decides and make sure that he doesn't miss out on his wife's or his mother's health. సో చాలా ఇంపార్టెంట్ టేక్ హోమ్ మెసేజ్. అందరూ ఫ్యామిలీలో ఒక యూనిట్ గా పనిచేస్తేనే ఫ్యామిలీ ముందడుగేస్తుంది. ఈ ఎర్లీ వార్నింగ్ సిగ్నల్స్ మీకు మీ వైఫ్ చెప్పలేకపోవచ్చు, కానీ మీరు కనుక్కోవడం కూడా ఈక్వల్లీ. సో మీరు చెప్పినట్టు, though it was more on the lighter side, but there was a very deep meaning to that. And
Yes.
I think all of us should take the deep meaning home today after 5:30 p.m.
Yes, sir. Thank you so much. Sir, shall we open the house for discussion? We have some questions coming up. Thank the
100%,
audience.
madam.
We have an excellent audience. I see a lot of people asking questions, and that is what we require from our audience. Ushashri Garu, thank you so much, Ushashri Garu. She's asked, for women above 60, how frequently should we get ourselves mammogrammed or tested? Women above 60.
Huh. I think that's a very, very important, Ushashri Garu, very nice question అండి. ఏంటంటే 60 years దాటిపోయాక or 50 years దాటాక initially we should do annual mammograms అంటే yearly ones. Now what happens is that guidelines లో ఇది మెన్షన్ చేస్తారు, బట్ అలా ఎవ్రీ ఇయర్ మ్యామోగ్రామ్ చేయాల్సిన అవసరం లేదమ్మా. ఇనీషియల్గా ఒక ఫస్ట్ 2 or 3 మ్యామోగ్రామ్స్ వన్స్ ఇన్ 1 to 2 years, ఆ మూడు రిపోర్ట్స్ నార్మల్గా వస్తే then you try to do it on a case by case or a need basis, so that what happens is that you do your breast self examination every month, and then yearly clinical breast examination, and then after the first 2 or 3 mammograms, then you try to do mammogram only when it's required and try to increase the interval. More than that, it's very important to know that with the current mammograms like 3D mammography or tomosynthesis, now they are slightly costlier, but the radiation exposure is actually 10 times less. So go for getting those mammograms done, so that your exposure to radiation is very, very less, and they are much less painful, and the outcome is much better. So I think very, very nice question. About the age of 60 years, do initially annual mammograms, then make it once in 2 years, and afterwards gradually you can do it on a need basis, or at least try to say stretch it by once in 3 years. So there are guidelines and recommendations, but for an individual person, it can vary depending on the requirement. అంటే అదే బై ఛాన్స్ ఆ పర్సన్ ఈ 65 years అండ్ వాళ్ళ సిస్టర్కి బ్రెస్ట్ క్యాన్సర్ కేమ్ అరౌండ్ సే 50 years 55 years, అప్పుడు మీరు కొంచెం కాషియస్గా ఉంటారు. Now she's 65 years, family history positive, and she's taking alcohol regularly. You have to be even more cautious. Now she obeys also, then you will make sure that the mammograms are done. So therefore, a combination of all of these come for us to decide, should you do mammogram frequently, once in a year, once in 2 years, or once in, or couple it with breast examinations.
Thank you so much. Ushashri Garu, is that the answer you wanted? Naga Parameshwari Garu is asking us a question. She says that got a lump in the breast or underwent surgery few years back. Lump is not cancer related. What could the future risk be for her? She says that she got it diagnosed. It was not a risk, cancer risk lump. So what is the future? Does she have to be frightened? Does Naga Garu have to be frightened?
అంటే మీనాక్షి గారి పర్పస్ and the purpose of all this Beyond Pinks campaign etc. is that we want to bring awareness. We don't want to frighten you, right? So therefore, it's like all lumps in the breast are not breast cancer. It could be a adenoma, could be a fibroadenoma, could be a fibrocystic disease. ఇవి కామన్గా హార్మోన్ చేంజెస్తో వచ్చే ఈ ప్రాబ్లమ్స్ ఉంటాయన్నమాట. సో అందుకోసమని మనం ఎనీ ఇన్ఫ్యాక్ట్ అక్రాస్ ద వరల్డ్ ద రూల్ ఈస్, ఏదైనా ఆపరేషన్ చేసి ఆ ముక్కను బయట తీసామంటే ఆ గడ్డ ఆ ముక్క టెస్టింగ్కి వెళ్ళాలి pathology ల్యాబ్కి. pathology ల్యాబ్లో ఆ రిపోర్ట్లో అది కనుక క్యాన్సర్ కాకపోతే మీరు వరి అవ్వక్కర్లేదు. Now, ductal carcinoma in situ, లేకపోతే లోబ్యులర్ కార్సినోమా ఇన్ సిటు అని చెప్పి 2 pathology టర్మ్స్ ఉన్నాయండి. ఈ రెండు కనుక వస్తే అప్పుడు తర్వాత ఫ్యూచర్ క్యాన్సర్ రిస్క్ ఉంది కనుక మనం కేర్ఫుల్గా ఉంటాం. మిగతా 95% ఆఫ్ లంప్స్ కెన్ బి బినైన్, లైక్ ఫైబ్రోసిస్, ఫైబ్రోసిస్టిక్ డిసీజ్. ఇట్ కుడ్ బి అ సిస్ట్, కుడ్ బి బినైన్ లంప్. సో నాగపరమేశ్వరి గారు, మీకు 6 years బ్యాక్ అయిన ఆపరేషన్లో ఆ లంప్ వాస్ నాట్ క్యాన్సర్ రిలేటెడ్. అది క్యాన్సర్కి రిస్క్ లేదు కనుక మీరు భయపడకండి, నిశ్చింతగా ఉండండి. రెగ్యులర్గా చెకప్స్కి మాత్రం వెళ్తూ ఉండండి. రెగ్యులర్ అంటే ఏంటి? నాట్ వన్స్ ఇన్ ఎ మంత్, వన్స్ ఇన్ 2 months, or once in 3 months. Once in a year or once in 1.5 2 years is enough. Any signal your body is giving you, don't neglect that. Take care of your family, but at the same time, if you are there, only then you can take care of your family. So don't miss the early warning signals of cancer. That's my tip and take home message for you and all of you. Thank you, madam.
Thank you. Sir, there's a question on a WhatsApp message I've just got from Sri Devi. She says that she has been diagnosed with breast cancer, but she's feeding an infant. So will she be permitted to feed her baby, or should she immediately stop feeding her baby? There is a problem.
Yeah, I can understand. Now, like as I was mentioning you some time back also, concept munde cheppenu meeku, what happens is pregnancy appudu kuda breast cancer raavachu. And pregnancy lo common ga you will have many lumps and physiological, ante adi maamuluga koncham manaki physiological changes, so you might find some breast changes and therefore breast cancer may get missed. It's very unfortunate that you got this problem. But బ్రెస్ట్ క్యాన్సర్కి ట్రీట్మెంట్లో కామన్గా కీమోథెరపీ ఇస్తూ ఉంటామండి. మీకు అది పాసిబిలీ అవసరం ఉండలేదేమో, అందుకే మీకు మీ డాక్టర్ గారు పాసిబిలీ బ్రెస్ట్ ఫీడ్ చేయమని చెప్పారు. అంటే ఇట్ మస్ట్ హ్యావ్ బీన్ ఫార్చునేట్లీ ఎర్లీ బ్రెస్ట్ క్యాన్సర్. అదే కనుక మీకు కీమోథెరపీ కనుక ప్లాన్ చేస్తే ఈ కెమికల్స్ బ్రెస్ట్ మిల్క్లో వస్తాయండి. ఆ కెమికల్స్ బ్రెస్ట్ మిల్క్లో వచ్చి దే ఆర్ హార్మ్ఫుల్ టు యువర్ చైల్డ్, టు యువర్ ఇన్ఫెంట్. సో breast cancer during pregnancy or after pregnancy or during the lactation, if it develops, అండ్ మీకు కనుక కీమోథెరపీ అవసరం ఉంటే కీమోథెరపీ వెళ్తూ ఉన్నప్పుడు బ్రెస్ట్ ఫీడింగ్ చేయకూడదు. అలాగే రేడియేషన్ కనుక అవసరం ఉంటే ఆ రేడియేషన్తో ఆ బ్రెస్ట్ టిష్యూలో కొన్ని చేంజెస్ వస్తాయి. సో ఇఫ్ రేడియేషన్ ఇస్ ప్లాన్డ్, అగైన్ మనం బ్రెస్ట్ ఫీడింగ్ చేయకూడదండి. లాస్ట్లీ, some patients may require some anti-hormone agents for the treatment of their breast cancer. A good number of these agents also reach in the breast milk and they might be harmful. So usually by and large, ఏదో ట్రీట్మెంట్ కనుక ఉంటే and if it's not very early breast cancer, better to stop breastfeeding. ఐఎమ్ ష్యూర్ మీరు మీ డాక్టర్ గారిని కన్సల్ట్ చేసే ఉంటారు. హీ మైట్ బి ఎ మెడికల్ ఆంకాలజిస్ట్ ఆర్ ఎ సర్జికల్ ఆంకాలజిస్ట్ ఆర్ ఎ రేడియేషన్ ఆంకాలజిస్ట్. ఇలా మీరు ఇంకా బ్రెస్ట్ ఫీడింగ్ చేస్తున్నారని చెప్పడం మాత్రం మర్చిపోకండి. ఎందుకంటే సమ్ టైమ్స్ మనం మిస్ అయిపోవచ్చు. సో అలాంటప్పుడు అది మన డ్యూటీ ఆల్సో టు ఇన్ఫార్మ్ డాక్టర్ దట్ ఐఎమ్ స్టిల్ ఫీడింగ్ మై ఇన్ఫాంట్, షుడ్ ఐ డూ ఇట్ ఆర్ నాట్.
Yes, sir. ఇప్పుడు ఫర్ ఆల్ దోస్ హు ఆర్ వాచింగ్, సింపుల్గా మనం యాక్చువల్లీ వీ కెన్ యాక్చువల్లీ హెల్ప్. పక్కన ఉన్న లేడీస్కి, జెంట్స్కి హెల్ప్ చేయొచ్చు. If we can just stop and tell people, it's very simple. All you have to do is put your arm up, put your hand on your breast and move it around to see whether you can feel a lump. Same way under your armpit. Chala simple andi. When you're having a bath, when you're generally feeling yourself, when you are trying to get into your clothes, ఇది అందరు చేయొచ్చు. మీరు మీ పని మనిషికి, మీ సిస్టర్స్కి, బ్రదర్స్కి, మీ ఫ్రెండ్స్కి చెప్పొచ్చు. It's nothing to be ashamed of. So actually, Rohit Memorial Trust, we do this. We go to groups of people and teach them how to do, self-evaluation. Just put your hand. It's like a game. We do a song. Alato kuchinna funny ga, even teenager pillalto, we can do it. So each one of us has an opportunity to go out and help people to find a problem. Dr. Garu, supposing you say someone has a small problem, what are the different steps? Step by step elagellali. ఇప్పుడు ఈ రోజు అనుకోండి, I have a feeling that there is a lump that is moving. What do I do next? Step by step.
So step one is, how does the lump feel? Is it soft or is it firm or is it hard? If the lump is hard, which means that you need to meet your doctor ASAP, as soon as possible. Any hard lump anywhere, we have to, overall the breast is a soft tissue. But if there is a hard lump there, then in that case, you have to meet your doctor without delay. If it's firm and if it's possibly, say during the period's time, at that time you might have some hormone changes and therefore a lump may crop up here or there. Wait for 5 to 7 days, wait for the 10th or 11th or 12th day or the 14th day, but if no improvement happens, you please consult your gynae or family physician whenever it's comfortable to you, but without delay. If it's a soft mass, then you don't have to worry much. Soft mass usually are almost always never cancer. But if a problem initially also చెప్పాను మీకు, ఏదైనా ఒక ప్రాబ్లం మన బాడీలో ఉంది, అది 3 months కంటే ఎక్కువ ఉండి ఇంప్రూవ్మెంట్ అవ్వట్లేదు, ట్రీట్మెంట్ ఏదో తీసుకొని తగ్గట్లేదు ఆర్ ఇంకా పెరుగుతోంది, దాన్ని నెగ్లెక్ట్ చేయకూడదు. సో హార్డ్ మాస్ డోంట్ నెగ్లెక్ట్. ఏఎస్ఏపి అంటే యాజ్ సూన్ యాజ్ పాసిబుల్, వీలైన త్వరగా మీ డాక్టర్ గారిని కలవండి. ఫర్మ్ మాస్, అది నెమ్మదిగా ఫర్మ్నెస్ ఇంక్రీజ్ అవుతుంది, సైజ్ పెరుగుతుంది, డాక్టర్ గారిని కలవాలి. ఇట్స్ ఎ సాఫ్ట్ మాస్, యూ కెన్ వెయిట్. సో స్టెప్ 1, ఫైండ్ అవుట్ ద కన్సిస్టెన్సీ. నౌ స్టెప్ 2, దాంతో పడిన డిశ్చార్జ్ అవుతుందా అంటే, ఇఫ్ దెర్ ఈస్ సమ్ నిపుల్ డిశ్చార్జ్ హ్యాపెనింగ్ and if it is bloody colored or towards the red colored, then you need to react without delay. If it's only a milk expression happening, you don't have to worry. Now if it's a mass confined here but then you find some armpit lo kuda mass undanukondi, అప్పుడు త్వరగా డాక్టర్ గారిని కలవాలి. అది బ్రెస్ట్ యాబ్సెస్ కావచ్చు, ఇన్ఫెక్షన్ కావచ్చు, కానీ అది ఆల్రెడీ మన బాడీలో ఇంకో చోట కనపడుతుంది. సో ఫైండింగ్ more than one lump or bump, get alerted without delay. So I think these 3 are important. And of course, once you meet your doctor, then you please explain to him what all you faced. So it's important for you to make sure you spend time with your doctor and give him the right history. so that he can react upon it.
Are there
Thank
any
you.
more questions, Tanuja? Are there any more questions that I am missing? While you get the questions together, Doctor, thank you so much. I would like to personally thank Sri Dharani Foundation, which was established in 2019. It's a non-profit organization in Telangana, Hyderabad. Dr. P. Sridhar, who started it, he is a visionary. I would like to congratulate and thank Dr. Sridhar for associating with this project too. He takes care of underprivileged people by giving them basic needs, and I'm very happy that such a philanthropic doctor has come forward to be a part of this. We also thank Roots Degree College for associating. It's very important that ఇలాంటి ఇన్ఫర్మేషన్ మన కాలేజ్ పిల్లలకి స్కూల్ పిల్లలకి ముందు నుంచి చెప్పాలి. When we were young, we had sex education. Sex education was compulsory. ఇప్పుడు అది లేదు. But education on health, on hygiene, on lifestyles, ఇవన్నీ కంపల్సరీ అవ్వాలి. I think it should be part of the curriculum, and colleges and schools should fight to have this awareness program, maybe once a week program where doctors come and speak. So I'm very happy that college is associated with us. Thank you so much, Beyond Pinks, for associating such wonderful people in this endeavor. Doctors, any point that I have missed out, because we are now talking only about one aspect, diagnostics, because we have another 3 series, and in that we will talk more about other aspects of cancer. So breast cancer law, diagnostic law, have we missed out anything else?
So, Madam, మీరు చెప్పినట్టు టుడే మా ఫోకస్ ఈజ్ ఆన్ సెల్ఫ్ కేర్ అండ్ డయాగ్నోసిస్. అసలు ఆ సెకండ్ స్టెప్ రాకూడదు. మన డయాగ్నోసిస్ ఆఫ్ బ్రెస్ట్ క్యాన్సరే కాకుండా ఉండడం కోసం సెల్ఫ్ కేర్ చాలా ఇంపార్టెంట్. సో దానికి మళ్ళీ టు ద ఎంటైర్ ఆడియన్స్, I would again like to send out the message that there are some risk factors which you can change. Make sure those risk factors are not there, and if they are there, from today start that change. అంటే ఒక హెల్దీ వెయిట్ మెయింటైన్ చేయడం చాలా ఇంపార్టెంట్ ఫీమేల్స్కి. మన ఏజ్ పెరిగే కొద్దీ మిగతా రెస్పాన్సిబిలిటీస్ వస్తాయి కనుక మనం మన హెల్త్ మీద అంత ఫోకస్ చేయం. So make sure your weight is maintained healthy. And for that, you have to exercise regularly. Physical activity, staying physically active is chala important. And especially in urban areas these days, కొంచెం ఆల్కహాల్ తీసుకోవడం నెమ్మదిగా in females also is, let's face it, it's happening. We know a lot of females are involved as part of social custom to drink alcohol. Don't drink alcohol, or else at least limit the alcoholic intake. If you are taking or have been told to take some hormone replacement therapy at 30 years, 35 years, 40 years, suppose the bones are weak, you're 50 years, etc., or some oral contraceptive pills like birth control pills, ask your doctor about the risks and make sure you find out what is right for you, because if there is more estrogen in the OC pills, and there's more chance exposure to these estrogens may elevate the risk of breast cancer. If other risk factors are there, then this might further add up to it. Breastfeed your children if possible. Try to have a child before the age of 30 years if possible, at least the first child. If you have family history of breast cancer or some gene changes in the BRCA1 or BRCA2, then talk to your doctor to lower the risk. I think these are very, very important. In fact, మేము కూడా యాజ్ డాక్టర్స్గా ఉట్టి పేషెంట్నే చూడమండి. పేషెంట్తో పాటు బ్రెస్ట్ క్యాన్సర్, ఓవరీ క్యాన్సర్ ఇవన్నీ ఉంటే పేషెంట్ వాళ్ళ ఫ్యామిలీకి కూడా ఈ రిస్క్ ఫ్యాక్టర్స్ ఎక్స్ప్లెయిన్ చేసి Meenakshi garu, over to you now. And
Thank you, sir.
any more questions, I'm happy to take.
You, ladies and gentlemen, you are listening to Dr. Palani Satya Dattatreya, DM in medical oncology and a very well-known oncologist. And I think with the curtain has gone up on a series. On 20th of October, we will be discussing myths. ఇప్పుడు మన గురించి మన సూపర్స్టిషన్స్ చాలా ఉంటాయి. బ్రెస్ట్ క్యాన్సర్ అంటే ఇలాగుంటుంది, అలాగుంటుంది, ఇది చేస్తే అది వస్తుంది, అది చేస్తే రాదు అని. Bursting Myths of Breast Cancer, 20th October, 4:30 to 5:15, same time. Advanced Therapies and Cure. This is very important for those who are already in cancer. 24th October is our time is 11:30 in the morning. And the last and the most important will be on the 31st of this month, and that is diet and lifestyle. So for all those who want to join us, please keep checking on our website. Beyond Pinks is doing yeoman service. I think in the pink aspect, they're going right beyond it. And in having Dr. Dattatreya on the panel and having a discussion like this, we're opening the world of opportunities for us to learn more, share more, care more. And whatever information మీరు ఈ రోజు ఏ ఇన్ఫర్మేషన్ వచ్చిందో आप जो भी सीख यहाँ से ले जा रहे हैं, share it with people around you, because if one becomes 10, then 10 becomes 100. So I thank you all for being here. I'm Dr. Meenakshi Anantram, Vice Chairman, Rohit Memorial Trust. We lost our son Rohit to cancer, and today we fight the battle against the disease, trying to give counseling to parents who are not ready to lose their children, and also awareness of different types of cancers. I thank Tanuja of Beyond Pinks for giving us this opportunity, and I know that you all have understood lifestyle is a very important part in us fighting this disease. Let us stay fit, let us stay healthy, let us stay aware, and above all, let us stay alive. Thank you so much. God bless you. Have a wonderful life. Catch you again next week, 20th October at 4:30 on the same channel. Thank you so much.